Guys, welcome back to Medical Coding with Blue. Today's episode is all about the seventh character for injuries explained, the initial or active treatment, the subsequent treatment, or sequela. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, my favorite subject by far, which is injuries and understanding the seventh character A, seventh character D, or the seventh character S. And what does it all mean? For some people, they get very intimidated by injuries. Injuries is not difficult to understand once you get a firm grasp of that seventh character, okay? Once you get that down, you are good to go, because then everything else is going to start falling into place and making sense. So once again, I do not do flashy things on the screen, but what I am going to offer you is an interactive experience. So if you will look at your ICD-10-CM guidelines, if you have the Optum 2023 Expert for Physicians ICD-10-CM, I'm in the guidelines on page 22, and I am at chapter 19, section A. And so I will give y'all a few minutes to look that up and get to that part where we can all look at it together. But I will say this also when it comes to injuries. You have to be very attentive to where this patient is in their injury journey. And working with your providers is very key in this, because sometimes they won't understand the importance of why is it important to list the external cause code, or why is it important to list why they got injured, like if they fell, or if it was on the job injury, or what happened, or where they did somebody push them into a wall or something. Why is that important to know? It is important for statistical reasons, because there's many things that we do with this data. Sometimes in some areas, they may see a recurrence of a particular type of injury. I've mentioned this several times about the state of Colorado. There was a lot of spiral fractures, and for the longest time, they couldn't figure out what was causing all of these spiral fractures. Of course, what is the most popular outdoor recreation thing to do in the state of Colorado? Ski, right? And so when you go downhill and you're going at a high rate of speed, and you crash into a tree, I mean, that's gonna twist your bones there. So once they got that data, they were able to come up with safety campaigns. And the coding was a huge part of it, because they were able to get that statistical data out there and say, hey, look, this is how many patients had these spiral fractures, and this is what they were doing. So that's why it's very important to always record the how the injury happened. I was going to say the method of injury. I could say that too. It's always important to have that recorded. So even though they may resist, it's 2 seconds to drag in that particular phrase of how they got that injury, which was like a fall down the stairs, or whatever the case may be, they were skiing, whatever they were doing. It's always important, because just because they say, well, we don't have to, doesn't mean that you should. So if they're saying that, well, we don't have to do that because insurance doesn't require it, it doesn't mean that you can't do it properly. Okay, so that's why I say this is about standing up for the proper things for these patients. It's not about, let's just make it like the shortcut ways as much as possible. This document has to be capture the detail and capture it correctly. I'm just saying. So with that said, in chapter 19 of the guidelines, in section A, it says on the the third paragraph, seventh character A, initial encounter, is used for each encounter where the patient is receiving active treatment for the condition. The best place to give you guys an example of this is when the patient presents to the ER. So let's just say the patient fell down and hurt their wrist. Now, we don't know what is wrong with the wrist. All we know is that the patient was injured while they're in the ER, right? Because the ER, they do their tests and they say, well, there's too much swelling. We don't know. The patient could possibly have a fracture, or it could possibly just be sprained. We don't know. So what the ER does is they stabilize this injury, and that injury is going to be, of course, unspecified injury of the left wrist. Let's just say left wrist. and they say, okay, well, we don't know what's wrong with you yet, but we're going to go ahead and put you in a splint and send you on over to ortho. So that injury code is going to be reported with the 7th character of A, because this is the first time they're seeking treatment for this injury. They fell. We don't know what's wrong with them because there's too much trauma to the area. So they have to wait until they get over to ortho. Well, then they get over to ortho and they say, okay, well, we're going to take this splint off and we're going to, give you an x-ray and see what's going on and see what we can see. All right. Because they're very familiar with injuries. They can see things maybe because like the swelling has gone down. And so then ortho discovers that they have a wrist fracture. So they say, okay, well, we're going to go ahead and put you in a cast for this wrist fracture because we need to stabilize this area. And so that code turns from an unspecified injury of the left wrist to the wrist fracture code, right? And so there's many different types, but for the sake of simplicity in explaining, I would just say wrist fracture A for initial. That's the 7th character. And so they go on and they put the cast on, and then they tell the patient, we're going to bring you back in a couple of weeks and find out if you're healing properly. Okay. So the patient comes back in 2 weeks and they do their checkup and they say, okay, you're healing properly, but we're going to go ahead and leave the cast in place for another 2 weeks. Okay. And so the patient says, fine. And then they're on their way. In that visit, that wrist fracture code is going to be reported with the 7th character of D, which according to the guidelines here, it says 7th character D, subsequent encounter, is used for encounters after the patient has completed active treatment for the condition and is receiving routine care for the condition during the healing or recovery phase. So in this second visit to ortho, this patient is in the recovery phase because the doctor says that, okay, the patient is healing normally, everything is fine, but we're just going to continue to keep you in this cast for another couple of weeks. That's totally okay because, again, the patient is healing normally. So that would be how you would be able to distinguish between an A and a D. Now, let's go back a little bit before we get too far ahead to the sequela part, because I know you all love sequela. If you love sequela as much as I do. So let's go back and let's say that the ER, the patient that came in because they fell and they hurt their wrist, the ER discovers that they have a fracture. So they say, well, you do have a fracture, but you need to go over to ortho because you either will be casted or they may send you in for surgery. We don't know. So we're still going to stabilize you and get you over there. Now that wrist fracture is going to be reported with an A in the ER, okay? A with the ER, okay? And so they've got the splint on and they send them over to ortho. Now ortho says, okay, well, you know what? This fracture is really bad. We're going to have to send you in for surgery. And so they say, okay, we'll schedule you for surgery in the morning, okay, in the morning time. So this patient is not in the healing phase yet, okay, because they are about to have surgery for this injury. So they are not quite in the subsequent or the D part of their healing phase yet. They're still in the active phase. So even though they are there with the ortho surgeon and the ortho surgeon says, hey, no, you need surgery. We need surgery to fix this. We're going to send you in for surgery. And so that's when you know you're still in the active phase because this patient is not on the road to healing yet. Even though this is the second time they've been seen. They've already been seen in the ER and they've been seen by this ortho surgeon. The ortho surgeon's making the decision that this patient needs to go to surgery. So this wrist fracture is still going to be with an A. It's still going to be with an A because they have not had the restorative treatment yet, which is that surgery. Okay. So any kind of restorative treatment, which is going to be like a casting, or it's going to be like for the surgery. Those are restorative treatments. All right. So the patient goes in the next morning and they do the surgery. Surgery is performed successfully. And then they say, okay, we will send you on your way home today and we'll get you, we'll catch you on follow-up. So then the patient comes back in a week and they want to check everything out, make sure everything's okay, or a few days, but let's just say a week for simplicity's sake. And so they say, okay, now the surgery was successful. You did really great. You appear to be healing very well as well right now. We don't see any issues. Your wounds are are healing quite nicely. And so in that visit, that's going to be the 7th character of D, because now the patient is in the healing phase of their injury, right? So you see how that happened? They had to have the surgery because that's going to be their restorative treatment. And then when they came back, they're doing okay, right? And so that's how we know that that's going to be subsequent. So that's going to be reported with the D. Now you would have thought that when they were thinking of how to do these 7th characters, that it would have been another letter other than D, because how do you put subsequent and D together? I don't know, but that's what they did. But now we have Sequela. So let's talk about Sequela for a little bit. So hopefully that cleared everything up on that side, and you understand what a subsequent encounter means. Subsequent just means that they are healing now, and they're in the healing phase. And so sometimes some fractures take a little bit longer to heal, and sometimes they will be out of their global period, right? But you can still code the fracture if that's what they're still continuing to treat. Again, not all patients are the same. Some patients will take a little bit longer to heal, and it's not that they have a non-union or a malunion. It's just maybe they have some issues, some vascular issues that are preventing them from healing quickly, okay? People who smoke have that issue because smoking affects the vascular system. So it makes it a little bit harder for bones to heal. And so it may take a little bit longer for a fracture to heal, and it may take longer than 90 days from the global period of either being casted or having the surgery. It may take a little bit longer just because of those issues. So if that's the case, then just find out where they are as far as where in their healing phase are they at. If it's still a subsequent, it's not quite a sequela yet because there's no other symptoms associated with it, which is, I'm getting ahead of myself, but a subsequent encounter is just going to mean that the patient is continuing to heal, that they are along that phase of healing. Okay, so that out of the way, let's talk about sequela. Sequela should be its own episode, but I'm going to include it on this one because sequela is a part of it, okay? You can't have one without the other, okay? So to read from chapter 19, section A, the guidelines describe it as 7th character S, sequela, is used for complications or conditions that arise as a direct result of a condition, such as a scar formation after a burn. The scars are sequela of the burn. When using 7th character S, it is necessary to use both the injury code that precipitated the sequela and the code for the sequela itself. The S is added only to the injury code, not the sequela code. The 7th character S identifies the injury responsible for the sequela. The specific type of sequela, scar, is sequenced first, followed by the injury code. So anytime like you see a patient who says, I fell down the stairs 5 years ago and I had broke my knee and my knee still hurts where my fracture was at. So they look and they say, okay, yes, the doctor identifies that the pain is related to the knee fracture, right? From when they fell down the stairs 5 years ago. So in that case, you would report knee pain. You would report the fracture of the knee with an S for the sequela, because that identifies the sequela. The knee pain is related to this injury, and that injury has that S at the end for sequela. Okay, so that's what is telling the insurance company. And then of course you're going to put the fall down the stairs with the S at the end. Okay, and you don't have to put the place of occurrence or any of those other things when it's a sequela. It's just the only thing that you're going to report is those three codes. The manifestation, which is in this case of the fractured knee, is going to be the knee pain, and then the fracture, and then the sequela. Okay, of the fall down the stairs with an S. So you're gonna have two codes with the S at the end, and then you're gonna have the knee pain listed first. Okay, so that's gonna tell whoever's looking at it that this knee pain is related to this injury, and this was a method of injury, is that they fell down the stairs. So sequela, like manifestations, they have different things that happen, like the burns, right, with the scar formation. So there's going to be different things. It's not just pain. It could be an ingrown nail. There's many patients who have like trauma to their big toe, like maybe they drop something on their toe, and while their toe is completely healed, their nail grows back ingrown every single time because of the trauma that was in that area. So that would be a sequela. That would be another example of a sequela, an ingrown nail, if it was tied to the trauma of the toe. Okay, so there always has to be language that puts them together. You can't just assume that they have an ingrown nail is because they had a trauma, okay? Or just because they had a fracture before, that pain is related to the fracture. It could be a number of things. It could be related to the nerves. It could be related to the skin. It could be related to the bones, of course, but you don't know. So you always have to look for that causative language to put them two together. Because if they said, okay, well, the patient has right toe pain, they had a fracture 5 years ago. Okay, is that toe pain related to that fracture, or is this something new? So that's why you have to kind of ask those questions. And when you have doctors who don't quite understand what sequela means, you have to explain it to them, because that's something that I regularly have to talk to my providers about, is sequela. Because they kind of look like, well, what if I don't know that it's related? I said, okay, if you don't know it's related, you don't know, it could be two completely different things, that's okay. But just tell me in the documentation, it's unknown if this is related to the injury that they previously had, in this area. You could say something like that. Okay, so that way I know, hey, these may be two different things. Because as an outpatient coder, I'm going to be looking at what is there and what is definitive, and what can I put together. We need to have that causative language in order to put sequela together. But when we are identifying injuries, that's going to be pretty simple as long as you tell me what happened to this patient. Because if you're telling me the patient came in with right toe pain, okay, unless you tell me, hey, because the patient dropped a book on their toe, then I know, okay, well, what happened? Did you do an x-ray? Was there, yes, we did an x-ray, and there was not a fracture, but there's a contusion. Okay, there's a contusion code for, that's your injury, the contusion, okay? And that would be an A if that's the first time if they saw the patient, okay? And if it was after that and they came in for a follow-up of the contusion and everything is fine, continue to, be careful, whatever, and they say it's still healing, it's still purple, whatever, then you can say, okay, then you're going to code that contusion code with a D at the end for subsequent, okay? So that's how you can kind of tell the differences between the different types of seventh character usage, okay? But one thing I did want to bring up here is this. And it says it very clearly in the first paragraph, where it says A, initial encounter, D, subsequent encounter, and S for sequela. Categories for traumatic fractures have additional seventh character values, and that's if they have a non-union or malunion. But while the patient may be seen by a new or different provider over the course of treatment for an injury, assignment of the seventh character is based on whether the patient is undergoing active treatment and not whether the provider is seeing the patient for the first time. So what does this mean? Let's just say that the patient had, gosh, what is a good one? A laceration. Let's just say they have a laceration. And so they decide to, they go out of town because they have something they have to do out of town. And so they're not able to follow up with their regular provider, right? And so they see a provider in this other town and they say, well, I have a laceration and, you know, they need to have their sutures removed and they need to get the wound checked, okay? That provider in that second town is not going to report an A. They are not going to report initial. Even though they have never seen that patient before, they are not going to report initial. Why? Because this patient has already been actively treated by another provider. They are just going to this provider temporarily, or maybe just right then and there, just to get some treatment for that laceration. Okay, so they've already done all their repair and all the washout and everything at their own doctor, but they're just coming to this doctor because they need to get this wound checked out. And that happens sometimes. Like usually you see that with people when they go on vacation. You can't just always stay where you are. And so sometimes you may have to visit a doctor when you're out of town, but that doctor would report that laceration with a 7th character of D because this patient is already in the healing phase. This is not the first time that they're being treated for that particular laceration. They're just being seen for like a follow-up, even though they've never seen this doctor before. They've already been actively treated by somebody else. Okay, does that make sense? So that's where you have to think about it. So there's going to be times where you're going to see the patient, they're going to come in for the first time, but they've already been seen someplace else, and they're just coming to this doctor for a follow-up or to establish care if they've moved. So if that's the case, then you know, okay, even though this is the first time this doctor is seeing this patient, it's not necessarily going to always be an A. We need to see what is the context of what is going on. If they are just here to establish care and the patient's already been actively treated, they still need to have somebody see them in a follow-up, that's going to be a D for subsequent, okay? So always make sure that you talk to your providers about that. Talk to them about the seriousness of listing the injury date, because that's always important too. You never know who is going to be looking at these documents for these injuries, whether it is a lawyer, a judge, or an insurance company. You never know. This is why this detail is so important. And even if the patient doesn't know the date, you can do approximate dates. That's fine, because it's just giving a little bit more context to what happened to them for this injury. All right. Now, if they have the exact date, that is even better. But sometimes they don't know. Sometimes, they just don't know when did they hit their head? Why do they have this big old goose egg on their head? Maybe they're having a good time and they just woke up like that. I don't know, so it really all depends on the individual, but to get as much detail as you can from the patient, from the doctor, from the patient is great. And that's what I always tell my providers too, that, if they know the date of when the injury occurred, that's great. You need to put it down. How did they get injured? If they know, that needs to be put down. And of course, any kind of detail that I can get about this injury. If the fracture, for example, was a displaced or a non-displaced, there's 2 different codes for that. So the detail of non-displaced or displaced should be there, because if it's not, then we have to default to displaced. So, but if they are displaced, then we need to know that, okay? It's not always good to just default just because, if it's specifically, a non-displaced, then we need to note that, all right? And it's the same thing if it's a laceration or if it's an abrasion or contusion, any of those words, we need to know those things, okay? We're not always going to pick up contusions, obviously, if it's in the same area as the injury, because that's a normal part. of that. But if those contusions or abrasions or lacerations are in a different area other than the fracture, then yes, you will pick those up, because that would mean that there's multiple injuries on this patient. And to wrap it up, because I could keep going about this, I always get so excited when I talk about injuries because there's so much to learn. But if you're wondering, Blue, how do I know how to sequence the injuries? Very easy, my friends, very easy. And if you look at me, see Blue, really easy. Well, I mean, it is when you think about it. What bought the bed? What is the most severest injury that this provider is taking care of? And what is causing them to do the most work? Obviously, that's going to be your first listed, and then so on and so forth. Obviously, a fracture is going to outrank an abrasion. So, I mean, think about that. You have to kind of think about abrasions, contusions. Those are bruising and things like that, a little scrape here and there. But those fractures are going to be pretty serious, right? So that's what you want to sequence first, is that most severest injury, which in the case of abrasions, contusions, and fractures, the fracture is going to come first, okay? Now, with these abrasions and things like that, if they have to obviously clean off the wound and things like that, that's going to be the next to a contusion. So contusion is going to be a bruise. There's not a whole lot you can do with the bruise other than just let it heal, right? And, just be careful with it. So bruising is very serious though, but that's when it comes to work that they actually have to do, abrasions are going to, do a little bit more work because they have to, clean it off or whatever. So that's just something to think about when you're thinking about how do we sequence. And the more practice you get, guys, with these types of things and injuries, the better off you'll be. And trust me, if you are going to go anywhere first to start as a coder, starting off in an urgent care center or even coding for an emergency department coder, that's going to give you exposure to everything, and including those injuries. Now, injuries, once you get really good with injuries, that's going to be your open ticket to basically go anywhere, because everybody needs an orthopedic coder. Whenever I go to any kind of conference or anything like that, they always ask me, what kind of coder are you? And I say, I code for orthopedics and podiatry. And they go, oh, we need an orthopedics coder really bad because people are scared of ortho. I don't know why, but if you don't have somebody to explain it to you, that makes it much more difficult to learn. But pay attention to chapter 19 in the guidelines, and it's going to break everything down there to you guys, okay? And it's going to help you to understand when to report certain things and when these certain things apply. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me in my little nerdy outburst. So if this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.